I'm Dean Padavan. I'm one of the primary care sports medicine physicians here at Atlantic Sports Health. And today I think we're talking about a few running injuries during the pandemic.
Go ahead.
So obviously a lot of people have been itching to exercise outside. There's been a lot of people trapped inside with the pandemic, and so we've been actually seeing a lot of running injuries in the office. I'm going to just go over a few just because they can get a little bit involved, but the most common ones that we see in the office include shin splints. So shin splints is a big one. The medical term for that is called medial tibial stress syndrome. We see a lot of people coming in with Achilles tendonitis. We also see a lot of people coming in with runner's knee, also known as patellofemoral syndrome. There's various reasons why this happens, but a lot of the times this can be precipitated by just ramping up people's mileage. So they may go from not doing anything to just jumping back into sports and jumping into very, very high mileage. We consider high mileage as being anyone who runs over 25 miles per week, give or take. And so we always say just start really, really slowly and ease your way up. I know a lot of our runners that may be listening agree to that 10% rule or follow that 10% rule in terms of mileage increase per week. I think it's a good rule as a general rule of thumb. The reason why people have these different types of pains, they're multifactorial. There's many different reasons. But again, I mentioned the mileage piece as being an issue. When we look at the pathology under the microscope, we think it may be related to micro tears in the tendons or bone remodeling when it comes to shin splint pain. With kneecap pain, we think it may be with kneecap tracking or some muscular imbalances around the knee. So these are some of the most common causes. In the office, when people come to see us, we try to isolate their biggest risk factors. And some of the biggest risk factors we see, besides the increase in mileage, include footwear and shoes. So I'm a big shoe snob. I like to tell a lot of my patients, especially a lot of my runners, that you have to wear the right shoes. I like supportive shoes that are cushioned. We have in Morristown and in the surrounding areas a lot of great running stores that people can go in and get their gait analyzed, and we can look at their foot type. So people who tend to be flat-footed or they pronate, so their feet kind of turn in a little bit, have increased risk for these problems. With Achilles tendon pain, I always tell people they should stay away from flatter shoes. So the difference between your heel and your forefoot is called your heel drop. If you have any Achilles pain, you really want that heel to be up a little bit so that you're tugging or putting a little bit of less pressure on your Achilles tendon. So shoes are really, really, really important. I always like to go to a better shoe first versus an orthotic, but if we're not able to decrease people's pain with a shoe, then of course over-the-counter orthotics as well as sometimes custom orthotics can be very, very helpful. When it comes to also prevention, we always look at people's lower leg strength and the flexibility. So if people have weak butt muscles, weak thigh muscles, weak shin muscles, it can put extra pressure on their tendons and their bones. So we often incorporate a lot of physical therapy, a lot of stretching to work on their flexibility. And we always tell our runners that it's important that they warm up, more so dynamically before they get going. That can also help the body prevent some of these injuries. We like more static stretching after exercise. We think that's very, very helpful. And those are kind of the quick tips that we like to give people in terms of preventing some of these injuries, being careful, and running safely.